I want to share with you Z's P's. I've added to this list, and so maybe there's 3 P's that are more important than the other. You already noticed when we first started talking about my persistence.
Yes.
Persistence is a big thing, polite persistence. Positive attitude. You have to work at that. It's not automatic. It's like going to the gym to exercise, and you're going to have a better physical body, but you have to practice on how to have a positive attitude and not let go of that. Passion, politeness, practice, patience. I don't have very much patience, but that's something my wife is working with me to improve. Pride, prosperity, and the most important one, Father Louis Richard taught me this, is prayer. And I can tell you, as I got older, I became more meaningful in my prayer. I've always been a good Christian, and I've always practiced my religion, but I never really got into the prayer emotionally thoughtful on a daily basis. And since I've been doing that for the last number of years, it's changed my life to be a more positive person. And to some extent, it has taken the stress away from me. And to be very truthful, I'm surprised that some of the prayers have been answered. Probably more than 50% of them. And a lot of people don't realize that until they start practicing it.
Welcome to Under the Knife, the podcast where we cut into topics such as politics, life advice, and medicine, and we do this with the precision of a licensed orthopedic surgeon. I'm your host, Dr. Craig Greene, an orthopedic surgeon and elected public official. Welcome to Under the Knife with Dr. Craig Greene. We're happy to have Mr. Richard Zuschlag. He wears many hats, but we're here to talk about you and your life, and there's been a lot of stories to tell, but you were/are the owner and founder of Acadian Ambulance. So we want to hear from Pennsylvania through Acadiana to now LSU Board of Supervisors and everywhere in between. So why don't you start us on that journey?
Well, first of all, I'll say I'm glad that you asked me to come do this. I'm honored and look forward to our nice visit. You know, God played a role in my life that I didn't know he was doing. In other words, I wasn't sure what I wanted to do when I graduated from engineering school. And the gentleman from Westinghouse Space and Defense Center in Baltimore was recruiting at my college. And he caught my attention because I had not yet been drafted to go to Vietnam. They had not gotten my number up yet. It was coming up that coming year on what number I'd end up with. And so he said, if you'll come to work for me, I'll get you a drafter for a job. That got my attention. And so I decided to go work for Westinghouse Space and Defense in Baltimore. And about 6 months after I was there, he said, I want to send you to Lafayette, Louisiana. You're going to be my experiment. And so I'm electrical engineer. Yeah. Wondering what kind of an experiment does he have.
And where's Lafayette, Louisiana?
Yeah, Lafayette, Louisiana. I had no idea. And so what it was is Westinghouse was upset because President Johnson was not spending the money in the Defense Center and the space program. He was doing social programs. So I was an experiment where they were getting contracts from the federal government to take disadvantaged young people and get them their high school equivalency so that they could work in positions in hospitals. In this case, in Lafayette General and Our Lady of Lourdes, they were getting their education so that they could be housekeepers. They could help in the kitchen, janitorial work.
And so what year is this?
Nurses' aides. That was back in 1970.
Okay.
So I got to Lafayette on July 22nd at 5 o'clock in a Skylark without any air conditioning, and the temperature was 101. I have never forgotten.
What experiment is this?
They don't have that kind of temperature in Pennsylvania.
Right.
And after about 2 weeks, I had dysentery because the Cajun food was so highly seasoned.
Yeah.
They all had a funny accent. They started talking about using flat-bottom canoes to get their kids to school. Yeah. It was kind of hard on me. I was in shock a little bit. In fact, after 6 months, I called my dad and said I wasn't happy. I was going to quit my job and move back to Greenville. That was something I really wanted to do.
6 weeks?
6 months.
6 months.
And I wanted to buy that little radio station that I worked at in Greenville. And I thought that I'd just be real happy having that radio station and working in that community.
It'd be simple.
Yeah. And he said, no, you gave them a 1-year commitment and you cannot move back home. And
what if he had said yes? Where would you be?
Something, I think that's what God played a role in.
Well, because you think about that, there's a pathway right there.
Yeah.
And there's the easy path, and there's the challenging path.
Yeah.
And if you look back, like if you're taking the easy path, who knows?
It's amazing to me how that changed my life. But the last 6 months, I started having friends. And when I got
last 6 months of
the
that
first year, yes.
I know it wasn't the last 6 months of this year.
And so my roommate, Richard Zuschlag, said, just come back to the Marines. And the CEO of the hospital was friends with him, and he suggested that we get together to know each other and get an apartment together. So it let me start meeting people in the community. And so what happened is when Westinghouse was finishing up at the end of the year to bring me back to Baltimore, which we had a pretty successful contract, I decided I wanted to quit and stay in Lafayette. Look how my mind changed in that 6-month period.
Well, you know what's interesting about that? It wasn't necessarily success that kept you, but relationships. And, one thing you and I have talked about that my dad always taught me was that life is about relationships.
Yes.
And you're a king of relationships.
Yeah.
I mean, you keep them cultivated and connect people. But it's interesting that at the 6-month mark where you could have taken the easy path, 6 months later, what kept you there was rich relationships.
And the fact that I was looking for some kind of a business to be involved in so I could stay.
And you didn't know what that was yet?
No, but we thought we might pattern our program after Westinghouse. If they could get those federal grants, we were going to have the Evangeline Training Academy. We almost incorporated that. We were working hard until all of a sudden the local funeral homes went into the police office and said the rules in Washington are changing too much and we no longer want to provide ambulance service. Here's the key to our ambulances. Get somebody else to do it. And that's what got me pretty excited because I remember when I worked for that little broadcast station in Greenville that they had a crisis with their ambulance service and they used a membership program to help underwrite the cost of the ambulance services. So I wrote to the mayor of Greenville, which was a new mayor, and asked him to send me all the paperwork on that ambulance service.
Did he?
He did.
Wow.
We put together a proposal, 3 of us, very young, no money.
How old were you?
I was 21. And my partner was 21, and then the gentleman from the hospital was like 29. So the 3 of us set that up. We took our proposal to the mayor. He said we're too young, we didn't have any money, it wasn't going to work. But the problem was nobody would submit proposals to him from anywhere.
Except
ours was the only one. You talk about persistence. In a 3-week period, I went to see him 4 times. He said no each time. And when I showed up the 4th time, I sat outside his office from 3 o'clock in the afternoon until 6:15 when we left, and he got mad. Why are you back here again? Please, Mr. Mayor, Ray Bertrand, would you call the mayor of Greenville and ask about this program? You can still tell me no, but I just want you to understand a little bit more how it works. You've not taken time to do that. Now, I didn't know that mayor. It had changed out. And I was gambling.
Would he even answer the phone?
He spent 20 minutes on the phone. And the next morning at 10 o'clock, he called me back in and said, okay, I have no other choice. I'm going to give you a chance.
But so unpacking that a little bit, a lot of people, after hearing no the first time, would have been like, well, okay, not supposed to happen. But he told you no 3 times, and the 4th time he waited 3 hours.
Yes.
And then just said, gave him a challenge, call this guy and then prove me wrong.
You know, he's deceased now, but on the 25th anniversary of our company, he gave a very emotional film report on out of the 10 years he was mayor, that was the best decision he'd ever made. Made me feel real good.
So tell us about, so the contract comes through, and I remember vaguely you telling a story of you had 1 ambulance.
2.
You were the driver.
Yeah. I had 2 ambulances. We couldn't borrow any money because we didn't have any assets. And so GMAC financed the first 2 ambulances at 16.5% interest. It's unbelievable. And I was a driver of one of the 2 ambulances for 2 years, and I wasn't the best driver.
There's only 2 drivers?
No. Well, you know what I think, this is a God thing. There were no paramedics or EMTs, and we were trying to find drivers and medics. We didn't want ambulance attendants. And all of a sudden, you have all these Vietnam medics coming back from the war, and they're standing in line and getting their unemployment check. And they've worked very hard for our country, and they believe they need that 6 months of vacation with the government paying their money. here I am hiring them, and then they don't get their money unless. And some of them wanted to box me out. They were upset with me for hiring them. They didn't want to come to work. Me hiring those Vietnam medics is the best thing I ever did because it gave us the credibility that this is a big change from the old ambulance days. These people knew how to save lives. They were involved with trauma cases.
Right.
And they knew how to handle air ambulance helicopters and ground ambulances. And I tell you, you had the Air Force, you had the Navy, you had the Army, you had the Coast Guard. They would all compete against each other to see who was the best medic. And I could tell. And so when I was doing my schedule, I had this one Army medic that really knew what he was doing, and I always wanted him to be on the shift with me because all I had was a merit badge from first aid. I'm a communications engineer. You know, one of the things I told the police jury when they decided to give us a yes answer with the mayor is, I'll tell you one thing I'm going to do is the beer trucks down here have better two-way radios than what the ambulances have at the hospital. And I'm going to set up a communication system that we're going to save lives. And we're going to do that because we have a good communication system. In fact, I was the first one in the state to pioneer a parish having 911 system. We had the first enhanced 911 system in Lafayette. And once I got that started in the early 80s, it expanded all across the state. And that made a big difference on the way people call for help.
So take us from 2 ambulances with 1 contract to Acadian Ambulance 2024.
In my mind, I thought if I would end up with maybe 5 to 8 ambulances in Lafayette and 40 employees, I had made it.
You've done it.
I didn't have any idea to grow. We didn't do enough planning, but enough parishes around us were struggling that they all started pushing and begging us to come help them out. Many of them were rural areas, and so we had some pretty big expansion. And I don't know quite how to say this is, but we probably didn't do enough planning, but we're doers rather than planners. So when the mayor or the police chief president of St. Martin Parish or Crowley or Acadia Parish called, we treated it like a 911 ambulance call. We went right over there and set up and got going.
Right.
And so we expanded pretty fast. I can't tell you how many people helped us do that. People in Louisiana are very helpful to others, and because we had a cause to save lives, all kinds of people rolled up their sleeves to try to help us out and be successful. Even though we're a private company, I can remember when we had to raise our membership from $18 to $24, it was like a 33% increase. And the president of the bank, by then we were banking with the bank, called in all the police jury members and presidents and said, look, they're operating this thing like a nonprofit. It's a private company. If you don't give them approval to raise their rates, which was a 33% rate increase, then you're going to have to take it back over because I can't finance them anymore. And he convinced them at that point not to leave it be in the contract that we had to go to get permission every year. As long as we did it within the cost of living index every year, we didn't have to have that permission. But we wanted to raise it over that, we had to go. We had to get permission, and that helped us out a lot. The bank, I think, the banker got us through the first crisis, and his name was Hubert Dumas. He was president of the Guarantee Bank and Trust. I can't tell you how much he helped us. He'd be like an informal member of our board. You all cannot take a raise until I see the budget. I want to approve the budget every year. I mean, he was very tactful, but he gave us all the money we wanted. And so we pretty much did what he told us to do.
Right. So then, along the way, because I would say you're very politically engaged, but it seems like from that very first contract, when you went to that mayor, even though you were offering something that would save lives, you had to have buy-in from the government official. So how did you cut your teeth in dealing with politicians, and what lessons have you learned between then and now?
I think that we had a good program with the Vietnam medics. And so when we do the annual membership campaign on radio and television, I'd go to the elected officials and ask them to help me promote it. And I think because we got a good opinion because of those Vietnam medics, people seem to flock to our side to be helpful most of the time. I can remember we were the first ambulance company in the South, for sure for Louisiana, where doctors wrote out standing orders for the medics because they were so competent. I tell you a little story that I had a problem with a doctor in Jennings that when we'd go into his emergency room after 7 or 8 at night and would be a trauma case, he couldn't get his surgical team out fast enough to save the life, so he'd take my medics into surgery, and the ambulance wouldn't be operating in Jennings for like 3 hours.
Because they were helping in surgery.
Yeah.
They're that good.
Yes. It really made a big difference. Within the first 2 years, Lafayette General had to go ahead and hire 24-hour physicians to work in the emergency room because we were getting people to the emergency room alive, and it was taking the on-call doctor a half hour to get there, and they were dying. So they started putting in 24-hour emergency room physicians right after we got started.
And that was probably what year?
That would be probably around 84, 85.
Okay. Yeah, because ER docs came out later than a lot of other subspecialties.
Right. Yes, that's correct. I just want to say, and I say this often, the employees I have are very conscientious and very dedicated. You can't find that workforce in other parts of the country. I haven't been able to find that. They are strong Christians, and they believe in giving back to their community, and they're hard workers. And if you treat them above average, they'll treat you in a responsible way. And I think that Acadian culture in South Louisiana, really is what helped get me started. And as I look over the names of people who just out of the clear blue sky decided they wanted to help, it was amazing the number of people that helped us get the company going, and to this day, they still do. So being involved with government officials is difficult.
Agreed.
I'm kind of in the middle. I try to find ways to compromise. Things have changed a lot. In the old days, Billy Toscan and Senator Breaux, they were very efficient in getting things done in Washington. Now it takes a long time to be able to get things done. But I'll just say, whether it's a Republican or Democrat, most everybody throughout the years have supported us. And that means a lot to me.
Well, y'all have a purpose and a mission.
Right.
And it's hard not to, if help us save lives and improve
Right.
the efficiency of healthcare.
Right.
For people to say no.
Yeah.
So
I've been pretty blessed with that.
Right. So once, like you said, if you had 5 and 40 employees, how many employees do you have now? Okay.
Just over 5,000.
And it's in Texas too, right?
Texas, Tennessee, and Mississippi.
Okay.
Yeah.
And how many ambulances are there?
750.
How many airplanes and helicopters?
Right now there's 14 helicopters and 3 fixed-wing airplanes that we use.
Now, how many what's a metric, like lives saved or lives transported?
It's hard for me to put a number on how many lives we might have saved. I'll just tell you, I don't go anywhere in this state unless somebody's telling me that my nephew, my son, my father works for you, or you saved this person's life, or you saved this person's life, you saved it. It really is amazing to hear the stories like that. Mm-hmm. You know, not every story is perfect, but I have transported, I think, somewhere probably about 13 million patients in the last 52 years. This year alone, we're going to do about 800,000 patients. That's an awful lot of people to move.
A lot of moving parts that go into that, too.
And there's a lot of things that can go wrong.
Right. So how do you... Talk to me a little bit about how you build a culture for 5,000 people in a space that it's high pressure.
Stressful,
but you have to have excellence. There's very low margin of error, but to also let them know we value you, we want to train you, support you, but you can't mess up.
So here's the deal. My 2 partners were concerned of all the changes in healthcare back in '98, Medicare reimbursement, and a company from the Northeast offered a nice amount of money to buy us out. And I got outvoted, and it was really hard on me. And Senator Breaux came along and suggested that I consider an ESOP. And I didn't understand ESOPs, and it took a long time to study that. But basically...
Tell our listeners what that means.
Yeah, ESOP means that if you save some of your own money in a 401k, the company will match that in company stock.
And so it ends up being employee-owned?
Yes. 80% of our company is currently owned by the employees, and my family has the other 20%. Probably over the next 2 or 3 years, we will sell that 20% to the company. It'll be 100% owned by the employees. So there's an incentive in there for them to make extra money for their retirement, substantial money. Somebody that might start out working and making $45,000 a year 25 years ago and ends up making $75,000 at the end of their career, be there for 35 years or so, will walk away with maybe $1.5 million maybe in their ESOP money, and maybe another $300,000 or $400,000 in their own 401k. So that's nearly $2 million. That's making a big difference in people's lives.
Right.
And so in most cases that keeps them staying there, even though it's a hard job, long hours.
Right.
They stay there because they want to be able to get that ESOP.
Well,
And you know, Russell Long, our senator from Louisiana, is the one that got that bill started. And I think there's right now about 7,000 ESOPs in the nation. Our company is the 16th largest one in the nation.
Wow.
So
Well, the great thing about that is it's a bit of unselfishness to say I'm going to give or sell you some of this company, but it's also they have skin in the game now.
Yes.
They're going to work every day for their company.
Right. You're right. And that does help the culture a great deal.
So talk to us about COVID, and actually let's back up and let's talk about Katrina, and tell us about your involvement in that, your lessons learned, how that changed the course of what you think for Louisiana, but also for Acadian Ambulance.
You know, we were given a big award from the National EMS Association in New Orleans on the Friday night before the hurricane came, Katrina. And I had played golf with the CEO of Baptist Hospital in Tulane. I had just expanded into New Orleans 9 months earlier. There was a lot of competition, and I was trying to get their business. And when we had our beer after the match, we started talking about that storm, and it was going in towards Mississippi. And we each talking about whether or not they were going to go to work Saturday morning or not. One of them had a boat and the other one didn't. It was just interesting how we were sitting there talking. So we went out to celebrate later that night our award, and I got a call about 7:30 in the morning, Saturday morning. And they told me I had to come back to Lafayette right away, that the hurricane had changed direction, was coming right at New Orleans. And I couldn't go on I-10. I had to go up on Highway 90. Got back to Lafayette at 2 o'clock. And I stayed in the communications center as a communications engineer, the one that built the center, 18 days. 18 days. It was something that I will never, ever, ever forget. An awful lot of people came to our rescue, ambulance companies across the nation, helicopters everywhere. It was very disorganized, mostly because of the lack of communications. Now, some elected officials did not get along well to begin with, but then you don't have a way of talking back and forth to each other. It even gets worse. During the middle of that storm, after they opened up the Superdome, they put us in charge of putting about 50 medics in there to try to keep the place going. And I'm a communications engineer. I had a backup to a backup, and I was the only one in the state that could talk from Lafayette or Baton Rouge on a handheld device inside the Superdome. And I actually flew one of my walkie-talkies from Lafayette over to the governor's mansion to give it to Kathleen Blanco so she could talk to the state police, because the doctors were writing down messages and handing them to the state trooper who was driving them back to the mansion like the old Pony Express days. I mean, the things that went on were unbelievable.
That wasn't 100 years ago.
No, it wasn't. There was all the things that went wrong, but we worked very hard, and we moved a lot of equipment in down there. We evacuated all those hospitals. It was dangerous. Our people were shot at. It's just, you know, one of the things that happened is that we got out to the Coast Guard commander out there at the military base in New Orleans. What's the name of the military base in New Orleans?
Belle Chase?
Yes, Belle Chase. We had a hard time getting him to understand, but he took one of our walkie-talkies, and when we had these, because we have a big 911 center, about 14 parishes went off the air, and those 911 calls all were coming to our center.
Yeah.
And I'm the only one with a radio system. So here I am radioing all these people stuck on roofs, and that's how he would figure out what helicopters to send to what rooftop. And this is a story I'll share from the 10-year anniversary. That man and I, the commander, spoke 100 times, and we became friends over the phone, but we never actually personally met each other until 10 years later.
Huh.
And we had a nice luncheon together. He took me out in the hallway and told me he had not done enough critical stress debriefing. something he learned. Our group did. My whole group spent months going through critical stress debriefing because that was hard on all of us. You know, we made some mistakes. We saved a lot of lives. There's some that we didn't save. But he shared with me, one of his medics, confessing to him out that morning that when the helicopter was coming down top of the roof, the grandma was on the edge of the roof, not up at the peak. And she had like a little 1-year-old baby. And she was trying to hand it to the medic who was strapped in, and he's reaching out as far as he can, and he can't get it. And the pilot's nervous because he's coming down too low, and he doesn't want the blades
to hit
the roof. And the fourth time he came down, the grandma threw the baby. And it went through the arms of the medic and right down into 10 feet of water.
Oh, my.
And they lost the baby. And that medic kept that inside of him all those years.
Whew. That's hard to keep in.
Yes, and so you start thinking about what people went through.
Right.
That's just one of many, many, many.
It's tragic.
Yes,
Yeah.
it's not good.
Well, that gets back to the space that y'all operate in is full of tragedy.
Right.
And you have to have people that are compassionate and excellent in a very impossible environment trying to provide hope.
Yeah, it's particularly bad when I see the medics upset when it's a child. But if they have children and they try to save this child that somebody ran over, it can really be emotionally tough on them. And I think that's something that it took a long time for us to realize. We have to have a culture that has people that can help them get through those problems. And that's something we work real hard on.
Talk to us about the sophistication of communication and even an ambulance now. Like, how much does one ambulance cost? Because the amount of technology and sophistication, whether it's the GPS system or the healthcare component of it, what was that like in the beginning?
In the beginning, you had ways of cleaning all your equipment. Everything they make now you have to throw away.
Yeah.
And everything you throw away costs all kinds of money to have a special trash bag to put it in. It's changed so much. The regulations they have put on us is overwhelming. And the reimbursement hasn't gone up, so we just have to get more and more efficient.
Right.
But an ambulance fully loaded today would be around $160,000. If you had a critical care unit that does the intensive care transports, it's more like $250,000. So a lot of money that we spend on equipment to try to keep our people very well trained. From the old days of EMTs and paramedics, it's amazing how much more training they have now. They're not quite a physician's assistant yet, but
they're close.
Yes.
Yeah. Talk to us about COVID. And I mean, no one really saw that coming or knew what to do about it when it got here. And, you know, Acadian you think of as in the transport business, and everything was shut down. But then y'all did some things in COVID. I know Scott Domain, where they build hospitals that are temporary and stuff. So how have you gone from, we just moved patients around in an ambulance to so much more?
Well, I want to tell you something. When they come up with the Medicare help to where hospitals could get advanced money and then pay it back later on, ambulance companies, public and private, were left out. Doctors' clinics were included, hospitals were included, but we got left out. And when they shut down the state, there were no more workman's comp accidents, very few.
Sure.
And the roads were bare. There was no more 911 car wrecks.
Right.
We have all these ambulances, so maybe, I cut them back in Baton Rouge and Lafayette, but places like New Roads or Kaplan, where there's only one ambulance, I had to leave it there, and you didn't have any calls.
Right.
We got one every other day, and so it was panic-stricken for us. And I worked with Senator Cassidy and Senator Kennedy and my congressman, and I really had a hard time. And finally, I got through to a guy that I had met early on that founded HCA, Dr. Scott over there in
Frist?
Yeah. No, well, this guy, Scott, Senator Scott was one of the ones that helped Frist get it started. And he went to bat to help us out, and I found out that a friend of mine that was a Democratic senator in Virginia, Mr. Warner, was somebody that the U.S. Treasurer liked on the Democratic side. And we had a bunch of conference calls with Senator Kennedy the Good Friday evening. It lasted till 11 at night. And the next day, they opened up portal for all ambulance companies to be able to get that assistance. If that hadn't happened, I believe our company might have gone bankrupt. I was so scared of what was happening to us because our volume completely diminished, yet we had all these expenses. And so, yes, our oil and gas company that was working offshore had done a bunch of other disaster work for hurricanes and the BP oil spill, that they went ahead and got into the business of start providing logistics for FEMA to be able to administer COVID shots in rural areas. We got big contracts in Florida, California. It's amazing what they did, and that transformed our company from just a transportation company to a logistical company, and it opened up a lot of new doors for us, and it really worked out well for us. That came along after we started getting the approval for our Medicare rates and everything for the lack of transports, and then we built up a war chest, and then we have to pay that all back over the next 3 years, but it kept us in business, and that was very important.
Well, and speaking of going from a transport to logistics, I remember Paul telling me at one point the offshore, because the people, employees to get offshore had to come through y'all's COVID checkpoint or whatever. So y'all would have to set up, like, we rent the entire hotel in some small town.
Yeah. You know, it's amazing. A number of major hospitals, which I won't mention, were COVID experts, so said, and they could keep COVID from expanding on the oil rigs. You know,
Or so they thought.
And an oil rig gets everybody sick and has to shut down. The oil company,
Massive,
you can't take that.
Yeah.
And one of our people came up with this plan where they had to all come to the hotel and get checked, and then we kept them at the hotel for 4 more days and checked them again before we let them go offshore.
Right.
But there wasn't enough staff to keep the hotels running. I mean, we'd get a 100-bed hotel here. At one time, we had 10.
And you had to feed them.
Yeah, we had 10 hotels that we were renting. It was unbelievable.
Yeah.
The logistics.
And the expense.
But all companies paid us, and we had a good track record.
Yeah.
Once a couple of them found out about what we were doing, and the oil rigs were still going, and nobody got on that rig that was sick, and the rig stayed healthy, it was extra money for them, but they worked with us almost 18 months doing that.
Well, Mr. Richard, I'm going to land the plane here for a minute. Your life has been so rich, but it's rich because of how much you've passed through and give to others. And from moving here from Westinghouse to now what you have, one of the questions I have for you, and I have 2 questions, and we'll wrap it up here. What would you, I'm not going to say your age, at your wisdom level, looking back to the young man that was 6 months here from Westinghouse and wanted to leave and go home, if you could pull him aside for 10 minutes, 15 minutes, and tell him 3 things, given the journey that you've had, what would those be?
Well, I want to share with you Z's P's. I've added to this list, and so maybe there's 3 P's that are more important than the other. You already noticed when we first started talking about my persistence.
Yes.
Persistence is a big thing, polite persistence. Positive attitude. You have to work at that. It's not automatic. It's like going into the gym to exercise, and you're going to have a better physical body, but you have to practice on how to have a positive attitude and not let go of that. Passion, politeness, practice, patience. I don't have very much patience, but that's something my wife is working with me to improve. Pride, prosperity, and the most important one, Father Louis Richard taught me this, is prayer. And I can tell you, as I got older, I became more meaningful in my prayer. I've always been a good Christian, and I've always practiced my religion, but I never really got into the prayer emotionally thoughtful on a daily basis. And since I've been doing that for the last number of years, it's changed my life to be a more positive person. And to some extent, it has taken the stress away from me. And to be very truthful, I'm surprised that some of the prayers have been answered. Probably more than 50% of them. And a lot of people don't realize that until they start practicing it.
Not only that, no is an answer to a prayer.
Yes.
Sometimes it's a better answer.
Z's P's, you know.
We gotta list those out.
There's a number of mistakes that I've made along the way. You got to surround yourself with loyal people. It's good to be smart. You want some smart people, but it's more important to have loyalty, so they don't take off on you and go try to cause a problem somewhere else. You know what I'm saying?
Right.
I'm a hard guy to work for, But my people stayed with me forever because I treated them better than other people.
Right.
You know, they got good compensation.
Well, I love Z's P's. We're going to pass that along. What a nugget for people. Last question. You're going to have, you certainly already do have a legacy. But what is the next chapter for Mr. Richard Zuschlag look like?
Well, I want to do more nonprofit work. I'm very much involved in Christian education, particularly the Catholic education around the Acadian area. I'm into that because I was Protestant and converted to Catholicism, but 80% of my management team were raised in Catholic high schools, and they didn't all make it through college. But that Christian education taught them how to work together, how to forgive each other, how to be a team, to be a family. And I think that's a big reason for part of my success. And so I want to end my life trying to take what money I do have to help fund those type of schools.
Well, look, I just want to thank you from the bottom of my heart. You're a friend, you're a mentor, but everything that you've shared with us today, it reminds me of what did Michael Jordan do on the court? He made everybody around him better. And everything that you've shared today is going to make everybody's lives richer and better, and I can't thank you enough. If people, do you want to be found, and if so, how can people find you?
You can reach me at richard@acadian.com, and you can look up the phone number and call me anytime you want to at Acadian Ambulance, which my number is 337-291-3302.
Thank you so much for being here. Lots of love to you and your family, and we look forward to having you back on sometime soon.
Thank you very much, sir.
All right, my friend. Take care.
Thank you for joining us today, and a big thank you to all of our listeners for tuning in to this surgical exploration of politics, healthcare, and life. I've been your host, Dr. Craig Greene. Remember to stay informed, stay sharp, and join us next time to see which of life's topics we'll dissect under the knife.